All right, good evening everyone and welcome to the Maine Frame fundraising event tonight. We are so honored and welcome to have you here. My name is Bill Robinson. I'm a licensed clinical professional counselor and the Director for Community and Behavioral Health from Andwell Health Partners. We're very proud to be sponsors of the event tonight. So I'll give you a brief introduction, tell you a little bit about what we do at our organization, and then I'll be welcoming Alec to the front to get the festivities started for tonight. So I guess it was about 5 months ago that Alec first came to us with a really inspirational idea. He talked to us about wanting to look and discover more about men's mental health. And that really touched me as someone that struggled with anxiety most of my adult life and had to work with it. I was immediately drawn to his idea, and we talked as a team and said we'd really like to be a part of this project and help. And we got to witness some of Alex's work and some of the rest of your work, and we were very impressed with the level of professionalism and the way that those messages were delivered. And finding film is such a medium that can be so powerful and can touch us in so many ways that it's really important in today's culture that we find opportunities to help break stigma and to raise awareness for what we need to do to help individuals. It's definitely something we're facing today. So let me tell you a little bit about Andwell Health Partners. Andwell Health Partners, I'm going to put my glasses on because it's a little dark in here and I'm getting old. I used to be able to memorize speeches, I can't anymore. The other thing I have to do is lose this tie and jacket so I can watch the films in comfort after that, because I'm a little overdressed. I didn't know how dressed up to be, so a little bit overdressed. But a little bit about Andwell Health Partners to get us started. So we're the largest nonprofit community health-based organization in the state of Maine, and we serve all 16 counties throughout the state. We have 11 offices from Presque Isle to Lewiston, Bridgeton to Dover-Foxcroft, Bangor to Wilton, and many more. We're an organization about living and living well. We provide a full continuum of care from womb to tomb, including maternal health programs for young moms, home health services to keep aging individuals in their own homes, palliative care medicine to help with long-term illness, occupational, physical, and speech therapies, behavioral health services, which I represent, caregivers, peer support specialists who come into the home and support individuals who are homebound or by themselves and need help with daily living and exercise and activities, and hospice and more. Our Community and Behavioral Health Division offers a wide range of services tailored to each individual, and our goal is to support whole person-centered health on the full continuum of healthcare services. So all of our mental health services are integrated with medical services whenever possible. We provide outpatient counseling, integrated case management services for children and adults, rehabilitative and community services for children on the autism spectrum. We have adult day programs and adult home and community-based services. All the services are designed with access to care and resources that individuals and families may need to live healthy, independent, and purpose-filled lives. Why is behavioral health important in the state of Maine, and why do we talk about it so much? Maine has an epidemic when it comes to behavioral health. In 2024, clients waited an average of 32 weeks to get access to mental health counseling services. There are 260,862 Mainers living in communities without adequate mental health supports. In 2023, Maine Crisis Lines received 117,000 calls, which was an increase of 30% since 2019. 1 in 6 children in Maine have been diagnosed with anxiety, and 20% of youth have experienced 2 or more adverse childhood experiences, be it a parent that's incarcerated, foster care, sexual trauma, all kinds of different experiences that lead to health risks at later dates as children get older. 77% of adults with a substance use disorder did not seek treatment in the state of Maine, and many of them thought that they could handle it on their own or wouldn't have access to that. Homelessness in Maine is another major epidemic. 1,342 people were living in shelters last year. 732 were in transitional housing, and 273 were unsheltered. And those are the numbers of folks that we know currently. September is an important month as it's National Suicide Prevention Month. According to the CDC in 2023, the suicide rate among males was 4 times higher than among females. In this country, someone dies by suicide every 11 minutes. We must shine a light on mental health needs, especially among our young men, and we must recognize how our culture has failed to support them. But there is hope. Thanks to support from individuals like yourselves, awareness is growing, stigma is breaking down, and conversations are beginning to happen. We are beginning to ask men what they need instead of telling them how they should be. And as a result, more men are now comfortable seeking treatment and care, a sign of hope and possibility. So in closing, tonight we celebrate how storytelling is a tool for healing, connection, and change, and we honor the courage it takes to speak up, to seek help, and to support one another. So thank you all for being here, and thank you for caring. Thanks for helping to make Maine a healthier and stronger place. And now to tell you more about the rest of the evening, I'll invite Alec Flutulip up.